Careblazer. One of the members inside of my Care Collective program recently asked a great question during one of our weekly question and answer sessions. And I figure many of you probably have the same question. And it was basically about, are people usually diagnosed with just one type of dementia, or are they usually diagnosed with multiple types of dementia? And would that impact the type of treatment that they get and how the disease progresses or it gets worse with time? So every week inside of the Care Collective program, we actually come together for live question and answer sessions. Sometimes they're with me, sometimes they're with an elder law attorney or a nutritionist who specializes in working with people with dementia. We have all kinds of experts. But in this particular question and answer session, it was me, and she was asking this question. And so let's back up and remember that the word dementia isn't a single disease. It's really a category. So if I were to ask the question differently, it could sound like, do most people with cancer have one specific type of cancer, or are they usually diagnosed with more than one type of cancer, right? So that's how we think about dementia. It's like it's a category, and it's really talking about a condition that impacts somebody's thinking and their physical functioning. You may have heard about it referred to as like an umbrella term. You may have even seen images online where there's like an umbrella and there's all these specific conditions underneath it: Lewy body dementia, frontal temporal dementia, vascular dementia, Alzheimer's disease, primary progressive aphasia, so on and so forth. And so here's the thing. The hard part is most people are in fact officially diagnosed with one type of dementia. However, mixed dementia, otherwise dementia of multiple types together, is actually quite common and probably way underdiagnosed. So while most people initially will receive one single type of dementia diagnosis, usually it's Alzheimer's disease. That's the most common type, with estimates ranging anywhere from 40 to 80% of all dementia cases actually being Alzheimer's disease type dementia. And estimates suggest about 1 in 10 people with dementia actually get a diagnosis of mixed dementia or dementia due to multiple etiologies, with the most common type being Alzheimer's disease and vascular dementia together. Often, the mixed type of dementia can come about with the person first getting the initial diagnosis of a single type, and then during follow-up appointments or follow-up evaluations, the healthcare provider thinks, oh, it's also starting to look like this type of dementia based on how they're doing, how their symptoms are progressing, how their brain scans look, or how their testing on the neuropsychological testing is coming out. And they'll think, we also think it's this type. So that's the one way the multiple or mixed type of dementia can come about. The other way can come about where the person is getting tested for the very first time, and it seems clear on that first assessment that they have more than one type of dementia. And so that can happen immediately as well. Now, the reason coming up with a specific diagnosis of dementia of the specific type can be challenging is because right now there is no blood or brain test that by itself can allow a doctor to definitively diagnose a certain type of dementia. It's still requiring multiple pieces of information beyond just a scan or beyond just a blood test. And there are many different factors that can impact how dementia looks. So it's really difficult with all the different types of dementia and how that looks in a certain person for, doctors sometimes to feel confident in the type of dementia somebody has. Now, in terms of treatment implications, unfortunately, right now, there is no medication that can stop the progression of the underlying disease happening, regardless of the type of dementia. There are medications to help with symptoms. There are even more recent medications that can slow down the progression, supposedly, but there's nothing that can stop it. So the disease will progress with time, no matter what, and no matter what type of dementia it is. Treatment is largely going to focus on what we can do to help manage the symptoms that the person with dementia is experiencing. And sometimes I get a follow-up follow-up question like, well, what's the point in even getting a diagnosis if there's nothing that we can do, if there's nothing that's going to stop it, if we don't have a cure, what is the point? There's lots of different reasons why getting an official diagnosis is very important, but one of the main ones is because we want to make sure it's not something else. There are many other conditions in old age that can look like dementia. Absolutely, the person can be forgetful, have poor attention issues, not want to shower, seem less interested in things that they've enjoyed in the past. Somebody can have all of those symptoms and it's still not dementia. It could be another type. In fact, I've done a whole video on what I call dementia lookalikes. So I'll link that below in the description. You can hop over there if you're curious about what that might be. Another thing I have found for family members and just having an accurate diagnosis is it brings them more peace of mind, understanding maybe how this disease is going to progress and how it's going to change with time. So certain dementias progress in different fashions and different timelines. It's not always perfect. Like we can't guarantee that's the way it's going to go, but for the most part, we get a general better idea of what we can expect as the disease progresses. And so sometimes having that specific diagnosis is helpful. In fact, I'd love to know if you have an official diagnosis, your loved one has an official diagnosis of some specific type of dementia. How has that helped you? Leave it in a comment below to share with other Careblazers. Careblazer, remember every single person is unique, and when somebody has dementia, there are other factors that can impact how that disease progresses. So for instance, there are other health conditions, the amount of help and support they have, the other medications that they're on, right? It's usually when people have dementia, there's many more conditions and health factors involved that's going to impact how that decline happens. Now, if you're interested in actually joining us in some of these weekly Q&A sessions, weekly support rooms, and having access to a 24/7 community of Careblazers, you can look into our Care Collective program. I'll make sure I link that below this video as well. Careblazer, thank you for doing everything you're doing for your loved one. If you have a specific question you want to make sure you would love to see answered on this channel, you can leave it below as well, and I'll take a look and you might just see it in an upcoming video. I'm sending you love. Thank you. And for those of you wondering, I am in a hotel room. I'm in Lake Havasu, Arizona, getting ready to do a full day training conference for family members and healthcare professionals on how to make dementia care easier, really.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.